Cincinnati's Children's Hospital Medical Center. Dr. Manning, the Gamble Center for Vaccine Research at Cincinnati Children's has in fact taken part in COVID-19 vaccine trials. And it's my understanding that more than 350 children have been a part of these trials. Can you tell us a little bit about what you've learned through this process, particularly in terms of the confidence that parents can have about vaccine safety and the effectiveness of the vaccine for this new age group, 5 to 11 years old?
Thanks, Dr. Vanderhoff. And I just want to echo the enthusiasm and the celebration that we're feeling here in pediatrics and at Cincinnati Children's for the ability to vaccinate this age group now. We are very proud to have participated in these vaccine trials, and we're proud to have had children in our region and our own neighborhoods participate in these trials. And from them, from those children and from these trials, we've learned that this vaccine is incredibly efficacious. It works. It is very effective at preventing disease, and COVID is now a vaccine preventable disease. The other thing we learned about the side effect profile, interestingly, is that the side effects are really quite similar to those that were reported in adults, but in children, they're actually less frequent and less severe. And I don't know if that means that children are more sturdy. I suspect that that could be the case, but children have tolerated this vaccine very well, and they have benefited. So it's safe, it's effective, and it's the right thing to do.
Thank you very much. Now, we know that parents, when it comes to their children, are really only concerned about what's best for their children. And there can be concerns about something new, especially a vaccine. And I know I've heard parents express concern about longer term potential consequences. What about fertility for my child down the line? What about what I've heard about myocarditis and pericarditis? Can you speak to those concerns that parents may have as they're contemplating this newly approved vaccine for their children who are 5 to 11 years old?
You know, I have great respect for the processes that families go through, parents go through when they make decisions on behalf of their children. They are the stewards of their children's health. And so, we greatly appreciate the thought that they put into these serious decisions. And so it's with great confidence that I can say that some of the concerns that have been raised about vaccines, and I'll speak first to fertility. The short answer to that question is no, there's no impact from these vaccines on fertility. It's a sometimes an unsatisfying answer to give, because the seeds that were sown around this risk were based in some very incorrect science. And so to simply say it's wrong, that's not true, sometimes doesn't feel robust enough to some families. But physician after physician will tell you that's simply untrue. There's no evidence whatsoever that fertility is affected by these vaccines. The second issue, you already spoke to myocarditis. It was not seen in our cohort of vaccine trial participants, which was great. Even when it is seen, it's very mild, and it is 6 to 7 times more commonly seen when you get COVID. So if you're worried about myocarditis in your child, you don't want them to get COVID. And if you don't want them to get COVID, you want them to be vaccinated, and the risk of myocarditis is exceptionally low. And then the third item around long-term effects, we hear this a lot about this new vaccine and that there's not been enough time. But we know 2 things about long-term effects related to COVID and the COVID vaccine. We know that vaccine side effects happen within the first 6 weeks. We know this from the COVID vaccine being administered to billions of people worldwide now. And we know this from other vaccines, that vaccines don't live in your system long term. They go away, they do their job, they stimulate your immune system, and then they go away. We also know for certain, we've seen it directly, that children can have long-term side effects from COVID. So if you're worried as a parent about long-term side effects, you really should be concerned about the risk of COVID. Even mild COVID in a child has the risk of long-term side effects. The vaccine does not. The vaccine will prevent that risk of long-term side effects from COVID.
Dr. Manning, I'd like you to elaborate a little bit further on that point that you're making, because it's one that I hear from caring parents all the time. And it's that, well, my understanding is, doctor, that most children get a relatively mild case of COVID if they get COVID. Aren't I better off letting them just get that mild case and get through it than I am subjecting them to this new vaccine? What's the response that you would offer a parent who's having that concern?
My first response to that is that it feels like an unnecessary risk to take, that your child would get COVID and that you're banking on it being mild, when in fact we've told you many times that we see children every day, including today at Cincinnati Children's Hospital, hospitalized with moderate to severe to quite serious COVID. And we can't tell you who that child will be. So you may gamble that your child would get mild COVID, but nobody could guarantee that that would be the case. They don't necessarily have to have pre-existing conditions. Some of the pre-existing conditions that do increase the severity of COVID are very common, things like asthma and obesity. And so going the route of sort of natural immunity or let them just get the disease feels like a risk to take with your child when we can tell you confidently that this is a vaccine preventable disease. And vaccines have prevented diseases and death in so many children in other ways. And COVID is causing many deaths. You gave some striking numbers earlier in this call about the number of deaths that we've had from COVID in children. So I would say that the risk is far greater if you want to take the chance of your child getting COVID than from the vaccine.
Thank you, Dr. Manning. Well, finally, I'm joined by Dr. Michelle Dritz, a pediatrician at Cornerstone Pediatrics in Miamisburg, and a delegate at large to the American Academy of Pediatrics for the Ohio chapter. Dr. Dritz, we know, and Dr. Manning just outlined this, that vaccines are an important part of keeping our children healthy, and that regular childhood immunizations, and I'd include the flu shot, can really make a difference in terms of saving lives and improving their health. The COVID-19 vaccines, of course, can be given at the same time a child gets a flu shot or another vaccine. Can you share with parents a little bit about why it's important to not let our children get behind on their shots, why it's important to stay up to date with those shots, and maybe be thinking about that when they're thinking about getting the COVID vaccine for their child?
Yes, thank you, Dr. Vanderhoff, for having me. I think that what we've already heard from Dr. Forbes and Dr. Manning emphasizes that point. I mean, vaccines, not just our COVID vaccine, but all the vaccines that we have available do a wonderful job of protecting our kids from all sorts of preventable illnesses, and unfortunately illnesses that for some people can be deadly. So the more that we can make sure that we're getting our kids vaccinated, both against this preventable COVID infection, as well as for all the many other preventable infections that luckily we don't see as much today because of the effectiveness of vaccines, the better. And I think after coming out of and continuing to be in this pandemic now for almost 2 years, we've seen a really significant drop in children getting many of the normal preventable vaccines that they've been getting over the years. And so we're in catch-up mode when it comes to their typical childhood vaccines, as well as now moving into this next phase, wonderfully, of having something that helps us prevent the COVID infection.
I think that it's probably fairly evident to those who are participating in this briefing that we've got 4 doctors who are all very, very excited about the advent of vaccination for this age group. But, you know, this is an age group that has been adjusting and learning to deal with the virus in so many ways, whether it's doing more with hand hygiene or sneeze etiquette or wearing masks in school. Can you just share a little bit with the parents and families about why this vaccine for this age group is something that makes physicians so excited, why we're so pleased to see the advent of the COVID-19 vaccine for 5 to 11-year-olds?
It's a game changer. I mean, of the many things that we know that can help protect us against any sort of illness or infection, especially the effectiveness we have seen with the COVID vaccine in the adults and the teenage range in terms of reducing complications, hospitalizations, death, and even infection. And as to Dr. Manning's point, even sometimes mild infection, we are seeing long-term complications with our kids and with our teenagers. So anything that allows us to really maximize that ability to protect our kids, I embrace wholeheartedly. And the COVID vaccine definitely is one of those. It certainly still goes hand in hand with the many other ways that we know have been effective in helping us fight against the coronavirus, like masking, like hand washing, like distancing, and trying to minimize how many people are around at one time. But hopefully, the more we're able to get our community vaccinated, the more we'll be able to pull back some of those other protective factors because of the vaccine's effectiveness in helping protect all of us, including our kids.
You know, parents really trust their child's doctor and routinely come to them with questions about their child's health care. I'm sure you're fielding, along with your colleagues, questions all the time about COVID-19, and especially now about the vaccine. Is there a specific, or is there a message or a theme that you're encountering frequently that you'd like to share with parents who may have some concerns about the virus and the vaccine?
Well, I mean, I just really start off that conversation asking them what questions they have. Because at the end of the day, and I tell this to my families and to all the parents and the teens and the kids that I see, I wouldn't recommend anything I wouldn't do for myself or for my own kids. And this is a vaccine that I've seen the research, I've watched the science, and I know it is both highly effective and safe. And that gives us just one more tool in our tool belt to help keep our children safe. And as parents, that's all we really want to do. Especially to Dr. Manning's point, if we're, as parents, if our goal is really to try to minimize the risks, to try to keep our kids as healthy and safe as possible, well, then we see now that the vaccine helps us do that much better. So please join me in getting our kids vaccinated.
Thank you so much, Dr. Dritz. Well, we know without a doubt that vaccines really do save lives. They've protected us for years from diseases that thankfully are now incredibly rare. Diseases like polio, measles, and mumps. Now, the COVID-19 vaccines can help us better protect our school-aged children and prevent them from becoming seriously ill or bringing the virus home to younger siblings or even older family members. This is a crucial turning point that I think you're hearing, we believe, will allow us to come closer to the end of this pandemic. And now I think we're ready to take questions, Alicia.
Thank you, Dr. Vanderhoff. Our first question today is from Joe Ingalls with Ohio Public Radio and Television.
Hello, doctors. Thank you for doing this. My question is, since the updated guidance on quarantine last week, and now that the vaccine is coming out, we are starting to see public school districts that were mandating masks in classrooms backing off of that and saying, hey, we don't need the mask mandate anymore because if someone is COVID exposed, the new quarantine guidance is that they have to wear a mask. Are you concerned that backing off of the mask now in these schools before the vaccine is able to take effect might actually cause more problems in the school district? What are your thoughts about that?
Well, I'll begin and then I'll certainly turn to my colleagues. Thank you for that very good question. I think the message that we're offering here is very clear. There's hope. We are seeing light at the end of a very long tunnel. And I think it's good that all of us are feeling upbeat and feeling that sense of hope. But the truth is, as I said earlier, we are not yet out of the woods. As we look at the cases of COVID-19 that are rising every day in every community across our state, they're still very, very high. Are they beginning to come down? Thankfully, they are. But they're still at very, very high levels, which means the risk of spread remains very, very high. And as I shared, it will be some time, even with robust uptake of the vaccine, before we have substantial numbers of our school-aged children who are fully vaccinated and therefore fully protected. So I think that we need to remember the common sense safety measures that all of us have spoken to, and I think especially Dr. Forbes spoke to, in terms of the importance of continuing to wear masks, wash our hands, avoid close contact with others when we can, and not lose sight of the fact that, yes, we're approaching the end of the tunnel, but there's still more of our journey in front of us. Let me turn to my colleagues. Maybe I'll begin with Dr. Forbes and just give them an opportunity to comment on this important question. Dr. Forbes?
Sure, thank you. Great question. You know, I think it gets back again to community health. And the way I look at the masking question in schools is why was the mandate there in the first place? And the mandate was there in my mind because the community prevalence was high. And so when community prevalence is lower, that's the threshold to consider the mask mandate or retracting the mask mandate. If the community prevalence is high, then you just have to wait. You know, I think, again, I can emphasize what you just said, Dr. Vanderhoff. We're almost there. You know, we have 37. I read about this and I've talked about this before. We had 37 summers of polio before Jonas Salk in Pittsburgh came out with the vaccine and his team. And then Dr. Sabin in Cincinnati came out with another polio vaccine. 37 summers. We're almost 22 months into this. We can do this. I say just wait, give it a few more weeks, few more months till we have enough penetration of the 5 to 11 vaccine, and then we can see the numbers go down. And then, we can look around and maybe declare an all clear at some point. But that's the reason for the mandate in the first place, is that it's still in the air. You don't take it away because the numbers appear to go down for a moment.
I'll turn to my other two colleagues. Anything that you'd like to add? If not, we'll move on to the next question. All right. I think we can move on.
Our next question is from Max Filby with the Columbus Dispatch.
Yeah, good morning, doctors. Given that this vaccine for 5 to 11-year-olds is shipping separately right now, I'm curious if you're anticipating any shortages or supply or logistics issues in the coming weeks for this vaccine. Thanks.
So this is Bruce. I think I'll field that question primarily. The numbers I shared are really substantial numbers of vaccine that are coming into the state this week. We're looking at, when you put it all together, a number that's approaching 400,000 doses. That's for a population that's less than 1 million. So I don't think supply is very likely to be our concern here. I think that there's going to be ample opportunity for people to get this vaccine in a timely way. Now, in the first days of the rollout, it's entirely possible that you may be seeking to get into one location or another and have some difficulty. But as we look at the first week or two, I think there is going to be a substantial and a very satisfactory supply here in the state. And Dr. Manning, I know, with your work and your institution's work around vaccine development, I don't know if you have anything you want to add to that.
It's a fair question, because early on in the pandemic, there were, some fits and starts in some of the supply chains for vaccination, but we feel very confident now. We're in a very different place. Many of the clinics, including our own, have received our vaccines already. The state was really planning ahead this time and saying, hey, even before their approval, let's get things going. And so I think we're in really good shape.
Thank you. Our final question that we have in the queue, I apologize, we actually have 2 more questions remaining. Our next question is from Mike McCarthy with WSYX WTTE.
Good morning, doctors. Thank you very much for making yourselves available. If you'll allow me, I wanted to change the topic a bit, and I think this would be best addressed by Dr. Vanderhoff. The governor this morning, his office announced that he has been exposed to COVID-19 from 2 staffers. I understand that he is feeling okay, not symptomatic, and he's tested negative. But I'm curious, since this has happened, have you had a chance to speak with Governor DeWine, what he has to say about this, and also what you think the fact that he's been exposed this late in the pandemic, what it says about kind of the status of things and where things stand in the state of Ohio right now?
Well, thanks for that question. Yeah, I think that this is about one of the best illustrations that we could have of why the message that we as 4 doctors are sharing today remains so important. And that is, look, vaccination is very, very important. And in addition to vaccination, during this time of very high transmission, when you are going to be around people, especially if you're going to be close to people and close to people in large numbers, you need to wear a mask. The governor has done all of that. And so as a result, he's acting out of what is clearly an abundance of caution, and not only meeting but exceeding quarantine recommendations, which is the right thing to do. As a leader, he is showing the way. But I think what his exposure demonstrates is that anybody can be exposed, including any vaccinated person, and that in this time period where COVID-19 transmission rates are still so very high, we're in the 300s in terms of cases per 100,000, with the threshold for being high around 100. So we're in the very high range. We have to be mindful of the context of the environment. And the environment now is one that has a lot of COVID-19 and COVID-19 transmission still in it. So I think if we had wanted a made to order example of why our message is spot on, this would have been it. Clearly, this was not manufactured, but just a natural illustration of the importance of getting vaccinated and then being mindful of one's environment and the importance in some circumstances of being masked, even if you're vaccinated.
Thank you, Dr. Vanderhoff. Our final question today comes from Jordan Laird with Dayton Daily News.
Thank you. So Dayton Children's is planning optimistically for 40% of its area children's 5 to 11 to get the vaccine, and teens continue to hover at around 43% vaccinated. That hasn't moved significantly in a while. So people are wondering, can we reach herd immunity if only 40% of 5 to 11-year-olds get vaccinated? Can you give a sense of where we are on the path to herd immunity?
Yeah, thanks for that question, and because I think it's a very, very important one. And it really speaks to the immunity that we are gaining as a state community against this terrible virus. First, we have to recognize that when we look at among eligible Ohioans who have received their first dose of the vaccine, so for everyone 12 years of age and older, as of this moment, we're very close to being at 65% of the population 12 and up who've gotten at least one dose of the vaccine. They're on the path. That's very encouraging. Now, layer on to that, when we look over the last couple months, it then becomes clear that despite the fact that for most of the people who are eligible and who are receiving the vaccine, vaccines have been available for quite some time, we're still seeing around 100,000 people a month come in and get the vaccine. Now, presumably, these are people who have been on the fence. These are people who've been reluctant to get vaccinated early on because they've had the opportunity, and yet they're continuing to make the decision, continuing to say, yeah, you know what, I think that is the right thing for me to do, which again is very encouraging. So we continue to see a steady stream of people receiving the vaccine in fairly substantial numbers. Now, as we layer on this next important age group, an age group who are out and about themselves a great deal because they go to school, it's further encouragement because if we are able to achieve substantial numbers of pediatric vaccinations, that's that much more of the population that is well protected and far less likely to spread the virus from one person to another. So overall, I'm very, very encouraged. We all, I think, as physicians, would like to see the vaccination rates be as high as possible because we believe this is good medicine. We believe this is the right thing for the vast majority of patients. We really believe it's the safest path for the vast majority of patients. Let me just pause there, though, and give my colleagues a chance to add any comments they might wish to add.
Doctor, if I can add to that, I think, both as a doctor and as a mom, one of the most heartbreaking effects that I've seen come with this pandemic and this infection has been kids and teens struggling with sadness and stress and anxiety and school upheaval and just hopelessness. So though we certainly recognize the importance of herd immunity to help broaden really the effectiveness of the vaccine in terms of our long-term protection of the community, even if individual vaccinations help get our kids back together with friends and family and loved ones, I think it's well worth it as well.
Dr. Vanderhoff, that's such an excellent comment from Dr. Dredson. I just want to piggyback on that because we've all paid a price during this pandemic. But as pediatricians, I think we really recognize the unique price that children have paid. School has been disrupted, their activities have been disrupted. This is their formative, developmental phase of life. And some of them may only have memory of life during the pandemic. Vaccination is a community service, as Dr. Forbes has pointed out, that public health is impacted by personal choice. This is a child's opportunity to actually contribute to helping us move out of this pandemic. And I fully believe that children lead the way quite often and can help us lead our way out of this as well.
Thank you. That was our final question for the day. Dr. Vanderhoff, if you'd like to share any closing remarks before we conclude the press conference, please feel free.
Well, thank you all again very much for taking time to join us for this briefing. And we are, again, very pleased with the ACIP and FDA Advisory Committee decisions regarding this new vaccine for this age group. And we look forward to seeing many of our children 5 to 11 years old gaining protection from COVID-19 through this vaccine. So thank you all very much.